Hello everyone, I am drberkkkaratas. We're going to talk about masturbation in children and infants. Now, of course, it is not very correct to call this masturbation. You know, it's generally said that way, but children and babies are just like us. They don't engage in masturbation or self-stimulation for sexual pleasure or because their sexual urges are heightened. This can generally start around 2-3 months of age. The periods are ages 4, 5, and 6. Century, it's the age period. During these periods, boys may play with their penises. They may rub against something. Girls may play with their vaginas and clitoral areas. Overall, this is a healthy behavior because they are trying to discover themselves. During this period, and when they discover themselves by touching certain parts of their bodies, it's about enjoyment. Of course, this is not sexual pleasure or sexual urge. I repeat, they enjoy it. They might want to engage in this behavior because it feels good. I think we need to say a few things about the family rather than just focusing on the child who is engaging in this behavior. Because, of course, you have a 6-year-old girl. In front of you, she's opened her legs. Here, her hand is a bit relaxed on her clitoris. When you see such a scene, it's more about the child's action, which is not an unhealthy behavior. She is discovering herself. The family's reaction is very important. What families need to do here, whether it's the mother, father, or siblings, is to not react at all. In other words, not even changing your facial expression. Here, one of the most important things to do right away is to distract them. So, okay, your child discovered this, noticed it. It's nice that she's doing this, but you can distract her attention. So, distracting them with a toy or saying, let's play a game, or finding another way to divert their attention becomes much more important. Sometimes, it's said that the reason for this behavior in children is lack of interest, not paying attention to the child, etc. Like that. In psychology, there are indeed statements in child psychology, but generally, most of the time, she's doing it because she's discovering herself. If there are other situations like this, they definitely need to be resolved. Of course, in this situation, you might be very engaged with the child, and despite your efforts to distract them, they may continue this behavior. In such a situation, it may be necessary to seek professional help. But I repeat, if children are engaging in this kind of behavior, it is not something abnormal. It's important to distract their attention. Once you distract their attention, they will likely stop that behavior, but if they keep repeating it, it's definitely worth consulting a pediatric neurologist or a child psychologist. It's not possible to find it everywhere. At the very least, you might need to visit a pediatrician to get some advice or recommendations or to explore other treatments if there are any. Thank you.